I'm Bob Dempsey, and I want to give our bi-weekly, every 2 weeks, roughly, update on the COVID crisis. I'm sorry to say we're in the middle of the crisis, but I want to start and end the meeting on a message of hope because I believe we're doing well. There are lots of things going on. There are lots of different ways of looking at it. Unfortunately, it's become politicalized. But there are some realities we have to face. One, we're at more than 13 million cases worldwide and more than 500,000 deaths. United States is 136,000 deaths and probably 3.5 million cases. Dane County is having an uptick. Wisconsin is having an uptick, but some very interesting things have been happening. There are parts of the world that have relatively cleared themselves of the outbreak, as other areas have increased. A lot of the other areas that have been increased, such as Latin America, India, are beginning to see a tremendous crowding or overwhelming of their hospitals, which we saw in New York, we saw in Milan, which we desperately hope never to see anywhere. But they're not seeing the death rates that we saw of 2 months ago. And that's important because there are reasons why we may be getting better at controlling the disease or the death rates or the hospitalizations. It may be that we're getting better at treating. There's some experimental treatments. There are ways to oxygenate people, which have probably dramatically decreased the death rates. There are more young people getting infected. That's good news and bad news. The good news is they tolerate it better. The bad news is they spread it to their elders. And so that's probably the biggest question. And the other is this virus is mutating. There is, of course, the possibility that some of the mutations will be less virulent, which may be what we're seeing. That's, of course, my hope. It's the most persistent virus, unlike many which would die out with seasonal changes or of its mutation rate. This one is still persistent. What does it mean? Well, it means that we are still locked down. We are still not traveling. The implications even for Wisconsin is that because of our rates increasing at a very steep rate, even without the death rate increasing, we are quarantined if we travel to New York City, for example. It's kind of unusual, but that's exactly where we are. Americans are quarantined or forbidden from going to other countries because of this. That's unfortunate. There are some things which are intriguing and possibly very interesting. Antibody trials, concoctions to treat people who have the disease to limit the virulence. And this may be one of the reasons why we're getting the death rates down. It may be happenstance, but it's sort of hope that we take. We've just been through, two really births of nations. Yesterday was Bastille Day, 11 days ago was the Declaration of Independence, the birthdays of these two countries. And if you look at those histories, they were hard won. They took years after. So let's hope that this is going to be an independence from COVID in the coming year. Similar sort of thing with hard efforts. There is hopeful news on the vaccine earlier than I thought. That is to say, the phase 1 trial of one vaccine for COVID shows that the people who got it were relatively safe. They had the normal reactions to vaccines only, and they developed antibodies. That doesn't prove that they won't get the disease, but it is suggestive of what you're trying to achieve with the vaccine. That is, antibodies to protect you from reinfection. That's the principle of vaccines. This one showed the first sign of safety. But realistically, it's not going to be ready for prime time prior to 2021. So what we're doing to retain or reduce the numbers of cases, which is wear a mask, wash your hands, don't mass together as people to spread to each other, is still going to be the main way we restrict it. So what does this mean when you're reopening a society or a university in the face of rising numbers? Well, it means that you're going to have a lot of young people who may get infected. And that's a moral, ethical, economic, political, and medical decision. The scientists wisely have just tried to attack the disease and give the facts as people make their choices. I think we can, as observers and participants, see where things are going. It's abundantly clear that the university wants to reopen and that the economy and the society must. The disruption of complete close down, the loss of jobs, the loss of food chain supply, the loss of social order, the violence that results, totally predictable, and unfortunately started the week after one of these meetings. We predicted such things would happen. So gradually reopen society, try to get sense of it, but within those three rules. Now, the university has been very good about setting a very ambitious plan of having students on campus. They're literally marking out seats in every auditorium where people would be allowed to sit and not sit. They're not going to allow people in campus, period, without masks. There'll be extensive testing. It might even work. It is the logical way that society needs to go forth, but it requires participation of everyone. Within this hospital, we're very, very strict, and we've been very successful at keeping people safe. Therefore, as part of the university, the medical school part, the labs, are beginning to open up. We have gotten approval for every lab and almost every clinical study or trial. And that means very close following of the rules, face masks, shields, etc. As we see clinical patients will allow us to do our academic job for all of the other things. A very important corollary of that is the one area which is not yet open, and that's the study we're doing with the Oneida Reservation. And they are very concerned about spread and so have not opened yet. But from that, we've done with the Shapiro program a really unique way to electronically use the modern technology to screen patients, to have them learn information about the trial, to sign up for the screening of the trial in preparation for when we are able to go to the reservation. So a lot of the large mass screenings, which we used to do of many patients in many populations which are not safe at this time, are eliminated by the electronic screening, which then allows us to meet one-to-one with just the selected study participants. It's brilliant, it makes sense. It's the new reality of what our world is going to be as we live with COVID. So we get to go on and do the work we've been doing, but in a different way, and I think a very positive way. Lots of good things have been done. We can't travel, we can't go be a visiting professor, we can't go to those meetings, but we have opened up an even better virtual professor program. Today we had a lecture from Cairo, and that's something that would have been extremely difficult previously, yet is very smooth, very cordial, and very educational. We're going to be doing much more of that as we think creatively about what we learned during this crisis and how we improve. The labs are doing very well. Dr. Alish has funded his grant, which is a great kudo, and academically we're doing well. Joyce Quake, our new PGY1, has won an award as best intern on the general surgery transplant service. These are the kudos, the academics. We've actually had an increase in the number of grants submitted, and also, I believe, manuscripts, as people have put their head down and said, there's an opportunity without the travel, without the sitting in airports. We can do our work, we can see our families more, we can have our meals. That's optimistic. Most important thing, though, as we open up safely, is we continue to protect the at-risk population, which, quite frankly, is all of us. Okay, so as we look at this, other realities take place. And one is the financial reality on the university and on UW Health and on the department. The news here is, of course, uncertain, but I want to be optimistic. I know that the initial tremendous hit that UW Health took because we closed down completely, which was too much. We need to close safely while allowing us to continue to care for the base patients that need us every day. We cannot have people not going to see the doctor and getting their blood pressure checked, because we saw what happens is they stroke, they bleed into their brain, and they come devastated. So prevention is key. Getting that done safely must be done. And financially, as we have started to do work, we've made up a great deal of the losses. We're not quite caught up, but I predict we will be by end of summer. And that means we're going to be able to maintain the programs we have, maintain the essential services we have, and we're going to be able to meet our bills. That's important. I believe that academics will be restricted regarding travel. We're going to be doing much more online, which is a savings, which will be necessary because we are in a recession, whether they call it that or not. And that means that we're going to need to be very creative about doing the education more cheaply, doing the academics more cheaply. We've already started that. So we will see differences as far as less travel, but we will see, I hope, more education, more academics going on. It's a priority, it's what we stand for, and I think the fact that we are opening up successfully is very good. What could change all of that is if we become a hotspot to the point where the hospital is overwhelmed and we cannot take care of our base patients because we're overwhelmed with infected patients. And if that were to happen, then everything would fall apart. And so it is essential we avoid that by modeling the positive behavior in society everywhere. But what about society? What about living with COVID? I described something that is almost our full program of education, research, and patient care, although modified. But what about our society? Well, the key to this is no big masses of people. So I don't see concerts. I don't see sports venues that require in-person audiences as opposed to televised audiences going on. Large groupings are just plain foolish. And you'll see this as you watch. Watch for the sports to be moved from fall to spring, hopeful that they'll be able to have audiences, paying audiences, I'll point out, for these events. I predict that'll be happening. Other events that can be televised, be they plays, concerts, or basketball games with small groups that could simply play before a television audience, you're going to see that. Some of these experiments will succeed and some will fail. Things will be different. My niece is Zooming her wedding in a week, and that's pretty neat. It's unfortunate we're not there to celebrate with them in the traditional fashion, but things are changing. We'll be videoing resident interviews. I don't know how that's going to work, but we're going to have to try it. The most important thing that I'm saying is that this has been quite a trial. We will get through it. The science will be able to handle this. We will keep the majority of people safe if they follow the rules. Our society is changed and probably will be forever changed. This will bring out the best and the worst. Politicians will hide the truth because it makes their country vulnerable or them, and that's sad, but it tells you a little bit about the quality of people. Other people will rally. That includes people that say, I don't like to wear a mask, but I'm going to, because I don't want to cause someone else to become infected. That's the strength of who we are, of what we stand for. It's going to be a very uneasy fall until we see if there is a crisis of hospitalizations and deaths. There will be more infections. That's abundantly clear. We could cut them out if we can change the way society is masking, not massing together and washing their hands. It's that simple. We can do that. Other countries don't have that opportunity to separate or to that hygiene or even the masks. So it's going to teach us a lot about us and about what we are and what we value. And I am optimistic. I started it that way. I'll end it that way. We are very strong people. I'm very proud of what you do. I'm very proud of in the face of this, you were still productive. You still cared for patients who had brain tumors, congenital anomalies, or needed your research. You still taught in very different ways. So that makes me happy. Times have changed, but it means it's also time we spend with our families. It's time we spend with the things that we cherish. So take care of yourselves. We are doing a little bit better. That is, we're weathering the storm. We're not going to be done in the short term, so do not fatigue. It's going to be a long term, but you can do it. And that's where we're going to end it. So I feel optimistic about us if we stay together on this. And I'll be happy to take any questions. Thank you. Are there any chats or people want to unmute themselves to ask questions about the university's process of reopening or other topics? Okay. Well, once again, thanks for all you do. We appreciate it very much. Bye now.